Hello, hi, it's Dr. Erica again. Thank you for joining me on today's topic. I'm coming briefly to talk about two particular drugs for treatment of glaucoma therapy. These drugs are more fourth in line, fifth in line for therapy, but they are very relevant because they are used. One is dipivefrin, and then the other is epinephrine. Epinephrine is no longer on the U.S. market for particular reasons such as side effects, systemic side effects, as well as local side effects of the eye. So dipivefrin is a prodrug of epinephrine, and it works in the eye to help reduce the intraocular pressure that causes glaucoma and the irritation to the muscle of the eye caused by intraocular pressure increase. This particular medication has a better side effect than epinephrine, very similar as well. Now, the concentration of epinephrine is a little bit lower than that of epinephrine. However, the medication is very much so in producing adverse side effects, but it is also very more relevant than epinephrine. It, intraocular pressure reduction is about equal. The local ocular adverse effects limits its use. So, like I said, it's like fourth line, fifth line, and the guideline therapy or algorithm of treatment. Contraindications are for patients who have had edema of the eye due to the retina, also patients who have had surgery or cataract surgery of the eye. Do not use this particular medication for that reasons, and we want to make sure that healthcare professionals who are watching the video are also aware of that. Again, do not use medication. Dipivefrin, if the patient has had a surgery of the eye or cataract removal. Also, patients who have edema of the eye. Okay, so do be aware of that. Systemic effects, that means adverse effects not just for the eye, but throughout the whole body. This medication is a local medication of the eye, but however, the side effects can be systemic all the way down throughout the body. Headache, anxiety, arrhythmia of the heart, increased sweating or perspiration. Also, tachycardia, which is a fast heart rate or fast heart beating. So patients who have a cardiovascular disease risk or patients who have cardiovascular disease should not use this medication or should use it with very, very strict caution. Okay, so do be aware of that. There's no cure for glaucoma right now. The only objective is to lower the intraocular pressure to a tolerable rate so that the patient may begin to have visual field functioning. So that is the goal of therapy. Now, future drug therapies are on the lookout and are being researched to be placed or to provide more effective treatment, better tolerated therapies, agents that are neuroprotective and act through mechanisms other than intraocular pressure reduction are likely to be part of the glaucoma therapy in the future. Again, medications that treat glaucoma not only by lowering intraocular pressure, but also by other means of causing a better vision for the patient is also being researched, which is good because the more routes to treating, that means the more effective. And so, if more effective, then the patient can have a better life and a better outcome, which is what we are looking for as healthcare providers. Okay. Now, the more consistent that patients utilize their local medications, the better the outcome. That includes intraocular pressure reduction using solutions, usually the beta blocker, the prostaglandin, maybe the dipivefrin even. Being consistent throughout therapy is going to make sure that the patient has the best outcome. The better the consistency and adherence, again, the better outcome. There's no current cure for glaucoma, only the goal of treating and preventing further loss due to the pressure that causes changes in glaucoma visual field. So do be aware of the no. There is another video of mine for glaucoma. Please visit that video as well to learn more about the different types of glaucoma that I talk about. Also the first line and second line treatments, the guideline recommendations as well by the American Academy of Ophthalmology, who gives the guidelines for treatment. So do be on the know about that and visit that video. Like, share, and subscribe, and leave any comments that you may have. Thank you for joining me. Have a great day.